everyone. Thanks so much for joining us today. We have a super exciting panel. I'm Tina. I'm a second-year MPH student in the Health Policy Management concentration. I'm the vice president of the HCO organization. We have Eric, who's the president of HCO, and Pinky, who's a treasurer, and then we have Dr. Bagan, the chair of the Health Policy and Management department. So first, I will let Dr. Bagan say a few words, and then Eric can introduce HCO, and Pinky can introduce herself.
Thank you, Tina. Welcome. Basically, we have wanted to do something like this for all of you so that you get a sense of how the different career pathways that our students have taken, our graduates, and I'm very happy they all answer the call to be in the front lines for duty and do this. So very excited about this. I hope that this panel is useful to all of you, and let's get started.
All right, so hello everyone. Thank you again for joining us today. Essentially, HCO is a student-led organization centered around the professional development and relationship building for our members. And we do this through skill building workshops, career panels, speaker events, and various networking opportunities across the various healthcare industries, which include, but are not limited to, the consulting industry, nonprofit, pharmaceutical industry, and the hospital industry. We recently sent out an email blast with the applications for next year's HCO e-board, so please look out for those. We'll be accepting them until tomorrow, May 6th at 11 a.m. And feel free to reach out to us if you have any questions about that. And for new students next year, please look out for emails from Andrea and from NYU GPH for next year's HCO, so you can be a part of our organization. Thank you again, and with that, I'd like to hand it off to Tina and Pinky, who will moderate the questions for our guests.
Thank you, Eric. I just wanted to let everyone know that the questions will be open throughout, so feel free to write your questions as they come up to you, and we'll be asking them between what you guys have asked and a few questions that the board has curated.
Okay, cool. So to begin, we'll have the panelists introduce themselves, like what year you guys are, what concentration, where you work now, and we'll go in a specific order. So the order I see on the panelists is Vivian's first, then Blair, then Akshatta, then Sheena, Ekemini, and Ramon. So yeah, so Vivian.
Oh, me first. Okay. Hi, everyone. I'm Vivian. Was part of the class of 2018 for Health Policy and Management with a concentration in management. I just started a brand new gig about a month ago at CrossX Health Solutions. It's a data analytics company. Their main product is essentially linking consumer data to health patient data to kind of like derive insights into patient behavior and kind of use that towards like healthcare marketing and kind of this shift towards consumer-driven healthcare that we're seeing in the space today. Yeah.
Hey everyone, I'm Blair. So I actually did not go to NYU, but I graduated last spring from Tulane with my MSPH in biostatistics. And from there, I've been working at Mercer in their healthcare consulting area of business since then. So looking forward to being an outsider on the panel.
Hello, everyone. I am Akshatta Dahake. I graduated in 2019 from NYU. I currently work at NYC Health and Hospitals as an assistant director in managed care operations. So I handle everything operations related to patient transportation, which involves but is not limited to ambulance services. And it's proved to be a crucial part in the crisis that we are in today when we have to move large patient volumes across New York City in response to the COVID-19 surge.
Hi everyone, Sheena Takar here. I graduated with my MPH from NYU in 2019, which was last year, and I concentrated on the management track. Right after I started working at Pfizer, and I've been there since, and my title is a manager in global health economics and outcomes research, and that sits within the patient health and impact group at Pfizer. and I support specifically the internal medicine division and specifically more a drug called tanezumab, which will be launching early next year.
Good afternoon, everyone. My name is Ekemini Isaiah. I work at Avalere Health, a healthcare consulting firm out of Washington, D.C., but I actually work here in New York. I'm a consultant one at Avalere, been there for about 2 years, working in our federal and state policy practice, predominantly working on federal healthcare with a focus on drug pricing reform. Prior to Avalere, I worked at Sachs Policy Group, which is a boutique health policy consulting firm in New York City, actually really close to NYU. Graduated in 2018 from the MPH program in the health policy management concentration with a focus of course, health policy. Very excited to answer some questions and give you guys some insight.
Everybody, my name is Ramon Alvarez. I'm a network analyst at Unitas. Unitas created a platform that connects social services to healthcare services to make sure that patients receive services to address their social determinants of needs. I, along with Sheena, am part of last year's cohort, so I graduated in May, and I concentrated in healthcare policy.
So our first question is, and don't forget the audience, like keep putting in questions as you get them. Why did you choose the industry that you're in, and how did you go about finding a role within that industry? So we can start in the same order with Vivian first.
Yeah, of course. So I had always been interested in health tech, but actually, weirdly enough, when I graduated, I actually started off in healthcare consulting. That's how I met Blair, one of my fellow panelists. I was there for about 2 years doing a lot of work around like health and benefits and employer solutions for healthcare access. And there I got exposed to a lot of what we called point solutions. So a lot of startups in the space trying to kind of fill the gaps in care that public services cannot really or don't have the resources to. So a lot of private and public sector partnerships, and seeing how these kind of like niche, how these niche markets like fit into individual patients' needs, whether it be like a diabetes solution like Omada and New, I'm sure you've seen ads about it, or like Talkspace. And so I became really interested in the consumer-directed healthcare space, and then that's what led me to my position now. And I've already lost track of what the question was. Can you say it again?
Yeah, sure. So why did you choose the industry that you're in, and how did you go about finding a role within that industry?
Right. So how I went about it. So I think I have kind of a unique experience in the fact that I got my job while in quarantine. I've literally never set foot in the office, haven't met anyone in person. So it was a lot of online networking, a lot of aggressive LinkedIn messaging, and leveraging the network that you have currently, because everyone is trying really hard to stay connected as best they can right now. So now is a better time than ever to just cold call and reach out, because everyone's really just open to talking to anybody at this point, because we're all just alone in our places. One resource that I think, can I put something in the chat?
Sure.
Okay, I'm a part of a networking group called Healthcare Club, and we actually just released a repository of healthcare related companies in the New York City area that are actually hiring and have proven hiring through COVID-19. Because as we know, with just kind of the unstable state of the economy, we're not really sure who's actually hiring. Like job recs that are up, that seem open are actually put on hold on the side. So the networking group that I'm a part of actually created a central repository for people who are posting active recs that they are looking for. So I think it would be a really useful resource for anyone who's searching right now for a full-time opportunity.
Nice. Perfect. Okay, Blair?
Okay, so I graduated last May, like I mentioned earlier, and truthfully, I didn't really know exactly what I wanted to do. I was kind of applying to jobs kind of all over the place. My focus was biostatistics, and my past internship experience was all kind of project management, data analytics. So pretty much anything with those words in the title I was applying for. So kind of once I started narrowing down the field, once I started interviewing, something that really caught my eye about Mercer was just kind of, it's something new every day because you work on various client teams. Every client has different needs. So you're never doing the same thing over and over again, which was something that appealed to me. and it also is very analytical, which is obviously what I did most of my work in my master's, was kind of analytics of data. So it's not as hands-on as what I worked on during my degree, but I think it's a nice balance of using those base analytical skills and people skills and kind of just finding solutions for various problems. So for me, it was really about kind of the right balance of what I was looking for in all these different jobs, and really had everything kind of wrapped up into one. So that's kind of how I landed where I was. In terms of how I got here and the application and interview process, like I said, I was kind of all over the place. Didn't really know what I wanted to do specifically. So it was a lot of speaking to people who had graduated before me, kind of getting their viewpoint on what they were doing for work, what they liked, what aspects of it they liked, just kind of advice on workplaces, things they thought workplaces did a good job of to make employees comfortable. So really a lot of, speaking to people in my network, like Vivian mentioned, cold calls, and just kind of messaging people to see, what they liked about their companies and getting a feel for what would be the best fit for me. And ultimately, after a long process and a lot of self-reflection, it kind of landed at Mercer.
Awesome. Thanks, Blair. Akshatta?
So I was always interested in quality improvement and to be involved in quality improvement. I did my internship on an asthma quality improvement project. So that's what I was looking to work in. When I was looking for positions, I networked with professors. I reached out to professors. So there was Dr. Pagan, Dr. Andrew Goodman, and all the instructors of my various classes that I could reach out to. So coincidentally, my continuous quality improvement class instructor also worked at NYC Health and Hospitals, and she reached out to me with an open position, and that's how I got connected with this position. It was not in quality improvement, but it had a lot of aspects of performance evaluation. So like I mentioned before, I work with patient transportation. So making sure these processes, the processes of ordering transportation are streamlined and the ambulance shows up in a timely manner and patients are transported to the appropriate level of care in a timely manner. So it was very similar to what I was looking for, and I'm happy that it worked out.
Sweet. That was awesome. Sheena?
Yeah, so I'll just start off by saying never would I have ever thought in a million years that I would end up in the pharmaceutical industry. But it was more that I knew what I didn't want to do when I was applying for a position at Pfizer and an internship at Pfizer. And so I just wanted an internship at a bigger company. I'd never gotten that experience before, and so I applied. My internship was also in health economics and outcomes research, which now I'll refer to as HEOR because it's really long to say. And for me, it was really just that perfect intersection between like the strategy and the science. Like I was really, I loved the science, I loved the research, but I was very passionate in learning more about the strategy, and having a position at this company with that sort of intersection was what really drove me to continue on with that sort of work. How I went about getting my job, well, I stuck to it. I was there ever since my internship. I continue on with an internship, and then I became a contractor, and then now I went into the position that I'm in today. But how typically people usually go into it is they usually maybe transition from consulting, or they do start off with an internship and then continue on. But yeah, I think I answered the question.
Yeah.
Great.
Sheena, Ekemini?
Yeah, I think in terms of health policy, I've always known that it's very interdisciplinary, and it's really found in so many different sectors of our healthcare or of the world. So at NYU, that's still the same. You find it in a GPH, you find it in Wagner, you find it in the medical school. It really requires stakeholders from across the spectrum to really come together collaboratively. So I approached learning in that cross-functional way, and I also loved working in that cross-functional way as well. Really being able to assess a policy proposal or regulation or legislation and seeing the impact of it from different stakeholders' perspectives, whether that's from a patient perspective, provider perspective, life sciences manufacturer perspective, and being able to really help clients think through the implications for them. So knowing that I really had an interest in, reading policy and understanding it and really thinking of implications from a rotating lens perspective, consulting really felt like the perfect place for me because I was able to really help clients from across the spectrum in that space. How I got to Avalere, I think my role at Avalere was very similar to my role at Sachs Policy Group prior to that. It was just on a bigger scale. Sachs Policy Group had like 15 people, and now Avalere has over 200. So really did have the opportunity to offer up the same skills just on a broader scale, and really leveraged my LinkedIn network to kind of get in conversations with people that were from NYU and from my undergrad that also worked at Avalere. But I think when I was looking at SPG, it was really important for me to leverage the opportunities at NYU in terms of career development, really leverage LinkedIn, leverage my professors, hearing the different places that they were researching or they were getting their news from, and using those places as launching pads of where I wanted to search for my career as a next step.
Awesome, thanks. Ramon?
Yeah, so I've always been fascinated in information technology, venture capital, and the startup way. So for me, I always really wanted to work at a small, scrappy startup. And given that I love public health, I really wanted to be in that healthcare sector. Unfortunately, my first job was more in emergency response technology, so public safety, which operates on the periphery of public health. So from there, I transitioned to work at Unitas, which is more public health centric. But both of those roles, I was able to find someone at that company who had previously gone to NYU and reached out to them on LinkedIn. Use that kind of in-person network to really get your way into the recruiting office. So definitely do urge everybody to reach out to people who you see on LinkedIn work at a specific company. You'll be surprised at where that can get you. As far as how I went about finding the role, I mentioned that, but yeah, just like Ekemini was mentioning, whatever your sources of information are a great way to really figure out what you want to specialize in. For example, since I'm fascinated by information technology, I subscribe to a ton of health IT newsletters that really just kind of give you the breaking news or anything that changes in regulatory aspects of it. So from there, you can really start honing in on what you really want to work in.
Perfect. Thanks, Ramon. And I think Pinky might take a question now from the Q&A.
Thank you, everyone, for submitting questions. So one of the ones that I'm seeing currently is, what are the current trends that you guys are seeing in your industry today? And where do you see any room for growth and expansion there?
Yeah, I can go first from a policy perspective. I think there are like three main buckets that we're currently seeing with our clients, right? The first is COVID-19. I think we can all say that most of us were not prepared in terms of healthcare systems for COVID-19. So we're starting to see a lot of flexibilities coming out from the federal government and from the states to kind of prepare themselves and kind of just approach it from a patient access, quality, and cost of care perspective. You're seeing a lot of flexibilities come out in regulation, and we're starting to see Congress looking at a potential fourth bill that could offer some type of additional financial support. So really helping clients understand the flexibilities that are coming from the federal government and from the states, and what that means for drug development, what that means for access, home health, people that need home infusions that can't go to their providers, what that means for telehealth, and kind of broadening out access to that to providers there. I'd say the second bucket is the elections in 2020. So a lot of our clients are kind of really focused on COVID and either really planning for long-term what that means potentially for drug development, or kind of putting the Band-Aid on in terms of access from a payer perspective. But we're really trying to make sure that our clients are aware of the proposals coming out especially from the Biden administration, that could really take, if he was elected, that could really impact them after the election. So preparing our clients for that, for example, like Medicare expansion, lowering eligibility from 65 to 60, what are the implications of that across the stakeholder spectrum? And then I think the third bucket are policies that we were discussing with clients prior to COVID. A lot of it relating to drug pricing reform. So benchmarking prices, drug pricing in Medicare off of an international index, potentially requiring inflation penalties for providers, redesigning Medicare Part D the benefit to put a cap or patient out-of-pocket cost. There was so much conversation coming out of the House and Senate, and they were starting to really align on some proposals. But I think COVID-19 really sucked the air out of the room when it came to those conversations, and really forced people to kind of redirect their priorities. So it'll be really interesting to see with the presidential election that's coming up, how these proposals that we've spent so much time investing in kind of translates after the election. So that's what I'm seeing from a policy perspective with my clients.
Definitely going to be interesting to see what happens with the elections. Thank you. Anybody else feel free to take it?
Yeah, I would say be open to like remote opportunities, given that everybody's telecommuting, especially in the healthcare sector and health tech specifically. You'll be able to support customers. If you're in New York City, you can provide support for someone in California. The barrier to entry for a lot of these roles has really been removed, just because now you can do it from the comfort of your own home. So I would definitely say look out for those remote opportunities and apply to them, because once you're in the company, maybe they would expand to a position in New York City or wherever you want to go. So it's all about getting your foot in the door. And I think there's definitely that lessen the barrier of entry.
I agree, definitely important to stay open to that. As much as I would love to start post-grad in office, remote's where it is right now. Anyone else? Okay, Tina, take it away with another question.
Okay, great. So you guys did mention like what your responsibilities on your job are, but if you can go like dig a little deeper and tell us exactly like what your day-to-day looks like, what your favorite part of your current job is, like what are the challenges you face, that would be helpful. So we can start with Vivian again.
Yeah, sure. So I'm actually currently trying to figure out my day-to-day because I literally just started. But my official title, I don't think I mentioned before, is project manager in DIFA products. So DIFA is Crossix's largest product at the moment. So a lot of my work comes around like cross-functional coordination between engineering, product strategy, the analysts, and then our also internal consulting firm, because we offer these analytics as a service as well to a bunch of large clients, you know, tell them how their campaigns are doing, give them kind of real-time analytics so they can pivot their marketing campaigns, their communication campaigns along the way. So what I've been actively involved in mostly is just a lot of like project management, which is surprisingly heavy in data analysis and analytics, just a lot of like KPI tracking and holding people accountable. And then another project that I'm a part of right now is the media push for the New York City government and COVID-19, like those ads that you're seeing right now around like, you know, the steps to staying home and like the risks of going out, and like and other communications that you're seeing on like those Hulu commercials that you can't get away from. Currently working on that campaign as well. So right now, obviously things are a little bit weird and a lot of people are putting stuff on pause. So another large chunk of my work is also just kind of like coordinating and prioritizing how things are going to get relaunched when people are a little bit more comfortable with resuming their day-to-day functions and like work as usual.
Nice. Cool. Thanks, Vivian. Blair?
So my day-to-day can be a little bit hard to describe, just because with consulting, kind of it's unpredictable. So I'm on a variety of sized clients as well, but I tend to work with mid to large market. So the larger employers, I think the smallest client I have is like 1,500 lives or so. So it's really kind of your days are structured around what your clients are currently needing or what they're working on. So a lot of what I'm doing now especially is really focused on COVID. So, you know, running modeling for them, how is this going to impact their budget, their claims, like how is this going to impact the lives of their workers as well? Fortunately, we're starting to look more at return to work strategies, which is optimistic, but so it's really a variety, but I would say generally it's a lot of project management, a lot of coordination between employers, the carriers they have, vendors that they use, and a lot of analysis and just kind of analytical things, being able to come up with, you know, creative solutions to whatever issues they have, or, you know, being able to build on current wellness programs they have, how to get people more engaged, how to kind of have their benefit programs run more smoothly. So it's nice. A lot of it is obviously team focused, but being able to independently work on your piece, share that with the larger group, and just kind of bounce ideas off each other. So, you know, kind of a lot of different skills in one, but it definitely keeps it interesting and keeps you busy day to day.
Awesome. Thanks, Blair. Akshatta?
So my current responsibilities include daily operations related to patient transportation, the invoicing and reconciliation of vendor payments, budgeting for future years, and newer projects, basically leveraging transportation in response to in response to emergencies, which held true during this pandemic. And I think that would be my favorite part as well. I always wanted to be able to support clinical teams and see direct impact of my work, which kind of held true during this pandemic when we had to transport large volumes of patients from one of the hardest hit boroughs in New York City, which was Queens, and we moved and redistributed patient volumes from these hard-hit hospitals to the hospitals which had more capacity. And we had some busy days, but it's good to see all of that slow down and see the results of our work. So yeah, I would say that would be my favorite part so far.
Awesome. Sheena?
Yeah, so my day-to-day is a lot of project management. Our team of 3 people probably manage 30 projects at once. And if anybody's interested in HEOR or learning more about HEOR, I can definitely give you more details, but I'll try to capture it quickly here. HEOR, I like to think of it, it has 3 pillars. So one is real-world evidence, real-world data. One is economic modeling and predictive modeling. Then the last one is clinical analysis or patient-reported outcome analysis. And so a lot of the projects that we do are building, developing retrospective, prospective studies to assess the burden of illness and the unmet need in the population regarding a specific disease state. So writing protocols, implementing the study, doing all sorts of analysis, that's one aspect. Then we also try to build predictive models based on that data and based on the clinical data of a product, and try to see, you know, implementing a drug into this population, how would it impact individuals from a clinical, humanistic, or economic perspective. So it's a lot of just project management day to day, and developing digital tools to build these models, writing protocols for these studies, and then just understanding the results and trying to build a story or a strategy around it so that the other teams in the business can take that and talk to payers, talk to individuals who might be interested in taking this product. And Pfizer's also doing a lot for the coronavirus crisis, and I've also been placed on a task force. So besides my work that I'm doing for the drug, we're also trying to see what other predictive models are out there, like the model that the White House is using right now to make their decisions, looking at all sorts of modeling and all sorts of data to really assess and really let the leadership know of what's going on in the field right now.
Awesome. Thanks, Sheena. So it seems like a lot of project management for sure. Okay, Ekemini?
Yeah, so as I mentioned before, I'm a consultant one. So I act as a manager for a lot of the retainer relationships in the projects that we do. So retainers are basically engagements with clients where on an ad hoc basis. So if they have a question that they want to propose, if they want to talk to subject matter experts, we can kind of talk to them on any time throughout the year, and projects are specific like scientific questions that they want us to kind of help them think through or address on a qualitative perspective or in a quantitative manner. So really help to oversee that, bringing subject matter expertise to clients, overseeing the work that junior staff is doing and bringing in senior staff in when necessary to help us answer these questions. Really doing that for a spectrum of clients, as I said before, focusing really on drug pricing reform and better healthcare overall. I think one of the questions was, what is like the favorite part of the current work that I do? And I think it goes back to the fact that every day is very different. At 4 o'clock, something is coming out from the administration or from states, and you never know what it is. And it completely requires you to kind of just be on your toes, and you're ready to dive in and be ready to respond to clients by the next day. So really being able to be flexible and constantly learning something new, or constantly being able to engage in new opportunities with clients is really what excites me and keeps me going, and keeps me from losing my mind every once in a while when these clients sometimes ask for a lot. But I really do enjoy the pace of it, and like I said before, that rotating perspective of being able to work with so many different clients.
Perfect. Thanks, Ekemini. Ramon?
Yeah, I think the key answer to this question was really project management. I think any role that you're going to find yourself in, that is something, a vital skill that you should bring to the table and you should hone, because there's always a demand for someone who could manage multiple moving parts across multiple companies or teams. So definitely try to hone those skills. As far as my current job responsibilities as a network analyst, I'm working specifically with one of our largest enterprise customers, which is Kaiser Permanente. So Kaiser has an initiative that they call Thrive Local. And what Thrive Local does is connect patients, so Kaiser Permanente members, as they call them, with social services in their area. So those social services include like food banks to address food insecurity, transportation, so non-emergency transportation, so they get to doctor's offices, education, employment, anything that we know as a social determinant of health. What my team does is looks up those resources in these areas. So Kaiser has a foothold in Washington State, the Northwest, which is Portland and some of Southern Washington, California, North and Southern California, kind of operate independently. Colorado, Georgia, Hawaii, and the Mid-Atlantic states, so Washington, D.C., some parts of suburban Maryland, Baltimore, and Northern Virginia. So within all of those areas, we're responsible for finding food banks, American Work Centers, so we're somewhere you can go get resume help. They'll help you find a job searches. So that is a lot of my current responsibility before COVID. So now that the pandemic is fully underway and picking up speed in a lot of these southern states, especially like Georgia and Colorado, we are looking for resources that help those affected by the pandemic that previously didn't need employment assistance or previously weren't food insecure, find those resources. So one of my favorite parts of my role is being able to apply those social determinants of health principles, and knowing how someone who is food insecure or can't get to the doctor's office really is lagging in this other aspect of their life where clinical care just doesn't cut it. So it's definitely applying the doctrine that we've been taught at NYU about social determinants of health and applying that in real life.
Perfect. Thanks, Ramon. So we have a lot of questions in the Q&A, so I'm going to actually switch to try to answer some of those. So anyone who wants to answer can answer. So one of our questions is, did you work while you were in school? And if so, how many classes or credits were you taking? Was it difficult to keep up with school and work? And also, is it hard to find a job while you were in school?
Yes. So I was fortunate enough to find a relatively flexible part-time job at a company. I think that those opportunities tend to pop up in more of like the smaller, leaner, more startup kind of companies out there, boutique consulting firms, small startups, flexible hour, like nonprofits, and like kind of care delivery kind of centers. So if that's something that you're interested in, I would suggest starting in those sectors. I was lucky enough to be able to extend my internship into that part-time job. So it was a little bit of an easier sell just because I had already worked for them part-time and I could show them what, the value that I could bring to the company. In terms of balance, it definitely got a little bit hairy at times, but I think, well, it's been a while. The normal course load unit is 14 units. What was it? Someone please tell me.
12, right?
12? Okay, so I stayed around what was average and expected up until graduation and managed about 30 hours a week. So it is definitely doable, and NYU is why I think it's greater than Columbia, is because the classes are at night. So I was able to maintain a normal work schedule and not have class interfere with my work at all. So I do know people who have worked full time while being a full-time student. I don't think I'd recommend it. Those people didn't look like they got enough sleep, but I mean, it's definitely possible logistically.
Yeah, I wholeheartedly agree with Vivian. My first year, I did not work. I was a full-time student. And then when I got my internship, my second year, that's when I started to work about 30 hours, I think, with the same thing as you, Vivian, with a full-time academic load. I agree that the smaller companies, especially like the advocacy groups, the boutique consulting firms, they're a lot more flexible. But I will say anyone that's putting out an internship opportunity is putting it out understanding that is most likely going to garner attention from students that need that type of flexibility. So I was very upfront with my employer of like, these are the hours that I would be able to work. I think I started from like 9 to 4, and then I was able to then like head downtown to NYU for class straight after. But I did ask for the ability to be flexible if like exams were coming up and I needed to like take some time to study, and they were very understanding about that. So just being very upfront about your expectations and what you need as a student, understanding that your academics may need to come first in certain settings. Was there any other part of the question that I'm missing here? Okay. Oh, there are also like TA opportunities as well that can be, you can get through the university. So I was a stats TA in GPH, and I was a policy TA in GPH and Wagner. So those are also opportunities closer to home that are funded through the university that are also available to students that have taken those classes.
Oh my God, yeah, I completely forgot TAing. Yeah, and yeah, even if there aren't any TA positions available in GPH, I completely forgot I did this. I TA'd for an undergrad class as well at NYU in like my undergraduate degree. So there are opportunities there as well.
For any of the international students out there in the audience, so I was an international student and I couldn't work outside of campus. So I worked part-time for 20 hours on campus, and because it was on campus, it was I could easily get to classes in time. It was less taxing, but I still found it exhausting during exam week. But yeah, because it was on campus, you could be very clear with them in the beginning about how many hours you can commit to and what your requirements are. So it's definitely possible. I worked full-time and then part-time on campus. So it's possible if you want to go that route.
Perfect. Anyone else?
I'll just say I really, really value getting field experience, even if it's unpaid, even if it's like 10 hours a week. So I did intern my first 2 semesters in my first year, one at a nonprofit organization and the other one at a startup. And then I got my internship at Pfizer, and the rule for me to continue at Pfizer was actually that I would have to do full-time. So I was also determined in finishing school, and I was also determined in continuing my work at Pfizer to get that experience. And not gonna lie, it was not the easiest thing in the world, but it did end up working out for me because I ended up getting a position out of it and the position that I wanted. So it's a very like individual thing. It depends on what you want. Depends on what you want out of your field experience. It depends on what you want out of school. Like, what do you want to focus on? Are you able to focus on both? It's a very individual thing, but hopefully hearing about what we did will encourage you or discourage you from choosing.
Perfect. All right, Piggy, if you have.
So someone asked if they don't have a lot of public health or analytical experiences, what are some things that you guys would recommend to help boost their resume? Do you think there's specific classes they should be taking? Maybe online classes on Coursera? Anything specific skills like Python or R that are required for your positions?
Yes. Any type of data analytics that you can get under your belt automatically pushes you to the front of the curve. Even if you don't think that you will want to work in data analytics, I took almost every epi and stats class that I was able to take, and being able to see a policy perspective and see a question and working with people in analytics and being in the data that they were able to drive and connect that for a client to what that means for them in terms of implications is really helpful. And sometimes that knowledge comes from that classwork, but also being able to code and help out and support clients. We're moving in a place with healthcare where it's very data driven, and that is the key skill that they're looking for a lot of their applicants. So if you can't code or if you can't do other things, but you have really other great attributes, they may look to someone else that may be able to support that. So I really encourage you to take advantage of the great data analytics that is available at NYU, taking courses that are free at the library or that are on Coursera, or I think there are some other like LinkedIn learning opportunities, and just get that under your belt. But also, like, you should also be very frequently, at least once a week, scanning job opportunities and seeing the environment and what those requirements are. So like what they may have required, I forgot what the old version of like Stata was, but like, and what people are using now, but like Stata may be out and ART may be in, and if you don't know that because you're not aware of the environment, you would be dedicating your time to something that's outdated. So constantly like keeping a list of what you need to do and being very honest about what your gaps are would be my recommendation there.
Yeah, I cannot second that enough. Data analytics was nowhere on my job description, but for the job that I currently have, but it is part of my everyday life. You can't escape it. Like, we're moving in the world where big data dictates everything. And, you know, it's like Ekemini said, the NYU library has awesome resources. I would recommend if you're like scared of like getting into it, because I know like R can be a little bit intimidating because it's like horrendous. But if I would recommend, like, the first place to start is maybe NYU library's Excel basics, you know, because everyone should at least have at least basic analytical skills of like VLOOKUPs, pivot tables underneath their belt before they start looking for jobs.
Definitely. I would say you want to be the person with the answer, and you want to be the person that people go look for the answer. And typically you have to know how to manipulate data, clean it, be able to do pivot tables. I will plug the data claims lab that I participated in my last year. Yeah, Jose Pagan did a great job at getting that up and running. You get a great set of like claims data, so whatever health insurance companies send or hospitals send to the health insurance company so they can get paid. I would also say check out Tableau. Tableau has a free student edition for a year. That and a ton of like data repositories, specifically right now, the COVID project. You can go to covidproject.com, I think, and just download all this free data about like testing rates, deaths, infections. Also, check out CMS, the Center for Medicaid and Medicaid. They have what's called the Blue Button, and they have like examples of their claims data that you can download freely and really just play around with it. Once you get comfortable and with the software, and you do that by playing around with it, you'll have a lot more comfort going into the interview and being like, yeah, I may not be like a data analyst, but I do have that experience and I'm willing to learn. And that will definitely get your foot in the door in many places.
Yeah, what I always told people, especially when I was a second year and I was speaking to first years like Ramon, when you're competing for internships, you're not only competing against people that are in New York, you're competing against other people from across the country that are looking to come to New York for their summer. So anything that you can do to really make yourself stand out, it will be really helpful. And it's a really good opportunity for you to sit down with your professors, sit down with your mentors, and communicate with them to say, this is the type of job that I want, this is the list of skills that I have, help me identify the gaps that I have that would make me a better applicant, and then like talk about what I can do to better that, whether that's taking a class or taking some time on your own to kind of build your data analytics skills, and just being very honest about it with yourself so that you are best positioned when it's time to find a job or to find an internship at the end of each year.
Yeah, I just want to say one thing. For me, I wish I took the advice that everybody just gave, because I didn't really have that much data experience when I was graduating, and I wish I did explore that a little bit more. For me, it's really important for me to understand the data, because we are going to get an Excel file with it all there, but it's like, how can we tell a story from this one number? What does this one number mean? Or how do we capture trends? And so, yes, being able to do the data analysis yourself is great, but also really being able to understand it and tell a story is what will really help you out a lot. And for me, what I did is actually, when I did come to Pfizer, I decided to spend an extra 10% of my time in the data department. And I started doing smaller projects for people in the data department. So that gave me that little bit of understanding. And so I tried my best to really gather that sort of information, that sort of expertise, even though I did not really focus on it in my education.
Definitely.
I actually did the same thing that Sheena said. I didn't have any of the data experiences, but I made sure that I would leverage my Excel skills, and I would say I was pretty good at it. Anything that you're trying to look at, any new project starts with data. You need to be able to learn how to how to read the data, how to tell a story. I started self-learning Tableau. Like Ramon mentioned, there are many free resources for Tableau. I reached out to somebody who works with NYC Health and Hospitals and kind of I'm not sure if they had webinars or something, but I'm sure there are free resources for Tableau that you can leverage. And Tableau looks really pretty, and you can just make simple data look so good on Tableau. So you should totally make use of those resources.
I definitely agree. I love playing around on Tableau and making it look nicer and aesthetically pleasing. We also have a question specifically for anybody who's been in the consulting field. So how much time you're spending traveling, working with your clients outside of New York?
Ekemini, you start that.
I was like,
so
Vivian,
yeah,
Vivian, I was like, maybe we were just chatting about this prior to this call. I think it really does depend on the firm, right? There are some firms that are just notorious where even in the job application or in the job portal, they say, if you're not willing to travel 50%, then this most likely isn't the position for you. I will say my traveling does vary client by client, and varies by the engagement. So mine is a little bit different because I actually live in New York now. My company is based in DC. So prior to COVID, I was probably traveling once or twice a week to either my base in DC or to a client. But I've had months where I only traveled once or twice a month. So it really does vary. I'd say from me in a policy perspective, once the House and Senate really get hot and they come close to like putting something out, or we know that something big is coming out from CMS, that's when clients really start to dedicate a lot of funds towards these types of projects and support. So that's when activity starts to pick up a little bit more. But during recesses and when we're really in times like this where priorities are shifting, we start to see travel come down a little bit. So the answer is there really is no great answer.
And I can speak to me at Mercer. All of my clients, fortunately, are in the tri-state area, or they're headquartered, honestly, most of them within New York City. So the furthest I've had to go so far was an hour-and-a-half train ride on New Jersey Transit. And it doesn't really happen too often, obviously. Typically, the springtime is usually when we see more client travel, but that also happened to be the same time that COVID started picking up, so we've been doing a lot of virtual meetings, but at least for Mercer, especially the New York office, you really don't do a lot of travel that's far. It's all kind of within a reasonable distance. Occasionally you'll see some, travel to health fairs, or if the company is headquartered elsewhere and has a main office in New York, you might go to the headquarters elsewhere, but really get to stay local, which for me is nice.
Yeah. When I was at Mercer, I didn't get on the plane too much, maybe like a couple times a year to visit clients at different sites if they were like a multi-site kind of client that had like a large office somewhere else. It wasn't too much travel. I know that when people talk about traveling consulting, they're generally looking at like the big four and kind of typical management consulting where you spend Monday through Thursday on site, which, that's what people normally think about. But it's obviously not the only option out there. And, it really just depends on like the culture of the firm that you're working for. Because like with Mercer, they make a concerted effort to make sure that your client book is local, so you can be, closer to your client as much as possible. I think the only client that I had outside of the tri-state area that was headquartered was like in Boston. So it really does depend. Not every consulting firm is like a Deloitte.
Perfect. Okay, cool. So we might have time for one or two more questions. I think something a lot of people are wondering is a lot of you have mentioned like data classes, but besides data classes, what other kinds of classes do you recommend taking? But also if you can provide like a key resource for your field. So like econ really helped me with, my role now. So if you can like pinpoint that class, I think that'd be really helpful.
I can start that. So because my job includes a lot of invoicing and budgeting, I particularly like the financial management class. I would say it's a fairly tough class, but because of it, I don't feel the huge numbers that I'm dealing with right now, I don't find them as daunting, and it also gave me a lot more flexibility to work on Excel. So I would say financial management is a good class to keep an eye out for.
I know you probably don't want this response, but I can probably think of an element or a project that I worked on out of all my core HPM classes that do relate to my position a lot now. Like, for example, EPI, I'm designing studies left and right, so I need to know that terminology. Biostats, to look at the data, analyze the data. Even financial management, like we manage the team's budget, we get a budget, and we have to, allocate money towards different projects based on that. So that even came into play. What I would do though is really try to get that really well-rounded education, and try to take classes that are out of your comfort zone, take classes that are in your comfort zone, because if you don't know what you want to go into yet, that's just going to help you out even more, just getting a flavor of different things, because each class that has its own projects, you get a taste of what's going to go, like what sort of work you might do in the real world. So that would definitely be my recommendation. And I'm sure, Dr. Pagan and Andrea are there to help you really get that well-rounded education during your master's.
Definitely take classes out of your comfort zone, like Sheena said, because you can make mistakes in school. It's better to know and be out of your comfort zone in school than be out of your comfort zone in real world.
Okay, so maybe I'll wrap it up with one more question. So also anyone who's has questions now, if you guys would be open to taking questions via email, you can email your questions, since we couldn't get to all of them today. So we're gonna end on a fun one. What books or podcasts are you guys reading or listening to that you would recommend, since we're all at home?
Yeah, I can start. So I've actually joined Oprah's book club on Instagram. And the book of the month is Hidden Valley Road by Robert Kolker, which is, I think, a really great book on the conversation around mental health. It kind of goes back to a family back in the 50s with 12 children, and 6 of the sons had were diagnosed with schizophrenia. So it talks about how over time the conversation of mental health has changed in some ways and hasn't in others. So I really recommend either going on, checking out her Instagram page and being part of the discussion, or checking out the book. It really is a great read so far. In terms of podcasts, I'm not gonna lie, usually I would have a very thorough list, but with COVID-19, my job required me to read so much, I've kind of stepped back on some of the content that I allow myself to take in, and I've placed a threshold on it. But normally I would listen to, on my commute into the city, like the New York Times daily podcast, Rachel Maddox's daily podcast, which is basically an audio recording of the prior night's episode. KFF's What the Health, not what the hell, but what the health is a great one too. I think especially if you are getting ready to start to do interviews, it's a great way to be aware of what's happening in the policy landscape. And I think they do a really good job in the first couple 5 or 10 minutes of really setting the stage. So if you're not as familiar with the topic, you can really listen to some experts tell you about the history of it, and then they talk you through it, which I think was really helpful in like conversing with people when of course the number one conversation in interviews was like, you know, what are you interested in health policy today? And I was like, I can tell you what they talked about in KFF today. And there are a few others that like are personal that I don't think is relevant to this panel, but those are the main ones.
Yeah, What the Health is great. Let's see what else. Oh, A16Z is another great podcast. It's very digestible. It's by the venture capital interest in Horowitz. It's basically very digestible, 16 minutes of just like, you know, what's hot and trending in the topic right now. And obviously with like COVID-19, healthcare, not just coronavirus, but healthcare in general has been on the forefront of everyone's mind. So they're talking a lot about how like the industry is responding, and what, you know, what the money is saying, and what we're kind of like expecting and seeing trends, you know, as we're moving forward through this and through these uncertain times. Book-wise, Sheryl Sandberg's Option B is awesome. It's a book, it's about like individual resiliency, which I think we could all just use a little dose of at the moment. And if we want to be really nerdy about it, it's not new, but Elizabeth Rosenthal's American Sickness is a must read.
I am currently rereading Adam Tanner's Our Body, Our Data, How Companies Make Millions Selling Our Medical Records. It's incredibly nerdy, but I think it's great, especially now that my work is really going back into medical records. So I'll just send that in the Slack in case anybody wants a fun read.
Perfect.
I am not much of a reader, so I probably would have skipped this question, but coincidentally, I was reading a book before the crisis. It's called Bellevue by David Oshinsky. It's about the history of Bellevue Hospital, which is the oldest public hospital in the US, I guess, and is now part of NYC Health and Hospitals. So the book is an interesting read given the pandemic, if anyone is interested in how New York City dealt with previous epidemics of yellow fever, cholera. I've not finished reading it, but I thought it was an interesting read for anyone who wants to.
Perfect. These are all awesome recommendations. I've actually read some of them. They're super interesting. Okay, awesome. Thank you guys. This is really great. And thank you to the attendees. Hope everyone learned something. And I hope you have an awesome rest of almost the end of the year.
Thank you to all the panelists who participated. We really appreciate it. And for the questions that we were not able to answer, we are collecting them, and we will answer and we will send an email to all of you.
Thank you for having us.
Thank you so much.
Bye, everyone. Thanks, everyone. Bye, HCO.
Take care, everyone.